Hi friends, welcome to classes by Lab Doctor. In today's class, let us discuss about the VLDL structure. So, when you see a lipid profile, you have parameters like cholesterol, triglyceride, HDL, LDL, which all we have discussed in our previous classes. And there is another parameter called as VLDL cholesterol. So, today let us understand what is this VLDL. So, VLDL is nothing but very low density lipoprotein. So it is a lipoprotein. So now what are these lipoproteins? Lipoproteins are the carriers or the van or the cars which will carry this cholesterol and triglyceride and see that the cells, the peripheral tissues, your muscles, your adipose cells, all of them get the required cholesterol and triglyceride. Why do we require cholesterol and triglyceride? Because we can use them as a source of energy. We can store them as an energy source. We can use them to make our cell membranes. We can use them to make hormones. But the problem is the cholesterol and triglyceride cannot mix with the blood. It has to be carried to that cell and hence they need a carrier. So this carrier is your lipoprotein. So this is the carrier, this is a van, and this is the lipoprotein. And these are your cholesterol and triglyceride. It is making them reach the destination. What is the destination here? The cell or the peripheral tissue. So there are different types of lipoproteins. You have your chylomicron, you have your LDL, you have your HDL, you have your VLDL, you have your IDL, intermediate density lipoprotein, etc. So there are different types of lipoprotein. Some are good, some are bad. Like we have your HDL cholesterol, which was a good cholesterol. It was acting like a good cop. It was clearing up whatever remnant lipids were there. It was cleaning and it was seeing that it reaches the liver and it is excreted. It was seeing that any excess of lipids are not there in our body. Whereas the LDL, your VLDL, your IDL, your chylomicron, these are pro-atherogenic. If they exceed a certain level, they are bound to cause more of a damage. So in a pro-atherogenic, VLDL also comes under this category. This VLDL mainly is synthesized or formed in the liver. Part of it is also formed by the intestinal mucosal cells, and they carry this triglyceride and cholesterol and they transport it. So this is a structure of a lipoprotein. Because it has to carry this cholesterol and triglyceride, it has to have something, which can carry it without changing it. So it has a phospholipid bilayer. So this layer is miscible with the blood, and this core is not miscible with the blood. So the core will have your triglyceride and cholesterol esters, and your outer layer, this phospholipid, will have this protein. It will also have this apolipoprotein, and it also has this free cholesterol. So all the lipoprotein, HDL, LDL, VLDL, IDL, chylomicron, they have this basic structure. Yes, the amount of cholesterol, the amount of triglyceride, the type of apolipoprotein, they vary. So you can see the different types of lipoproteins: chylomicron, VLDL, IDL, LDL, HDL. So HDL is the highest density. Okay, and here you will see that chylomicron has very low density, and you can see the HDL has almost half of it is protein, whereas you can see the chylomicron almost 75% of it is your lipids. this chylomicron, VLDL, IDL, LDL, they are classified as bad cholesterol or non-HDL cholesterol. Cholesterol which is not HDL, they are non-HDL cholesterol. So your non-HDL includes all of them. Chylomicron, VLDL, IDL. IDL is also called as VLDL remnant and LDL. And your good cholesterol is your HDL cholesterol. So I have also talked about anti-atherogenic, pro-atherogenic. So only HDL is anti-atherogenic. So we want HDL levels to be higher. And chylomicron, VLDL, their remnants, LDL, they are pro-atherogenic. We want their levels in the blood to be lower. So now coming to VLDL, what is the structure? I've told you that this is basically a lipoprotein. So it has to have phospholipids, it has to have your core, it has to have your apolipoprotein. So this cholesterol, esters and triglyceride make the core, whereas this the phospholipid layer gives them a protection so that they can carry it safely to the peripheral tissue, and there are various other apoproteins in this structure. So you can see this is a chylomicron, this is a VLDL. In the chylomicron, it is having more of triglyceride and cholesterol ester. As we keep on moving, you will know that from VLDL, this is carrying more of triglyceride, and as we come to LDL, you will have more of cholesterol ester. So the triglyceride goes and the cholesterol will be more here, and the protein component of them is very less, whereas more of protein is seen in this HDL. So these have a major apolipoprotein, that is apoB100. So VLDL has almost 60% triglyceride. So if you have excess VLDL, you can make out how dangerous it can be and how much the cells can be loaded with this TGs. So the rest would be your cholesterol 15%, protein is only 10%, and phospholipid is 15%. When we see the structure, you will see that this VLDL, I have told you that it is produced in the liver and also in the intestine, and it is almost between the density of chylomicron and your HDL, and having a diameter of around 30 to 80 nanometer, and this VLDL is having 93% total lipid and only 7% is protein. Okay, so this is how the VLDL is, and it is having different apoproteins. Main apoprotein is apoB100. In the later classes, you will see that this VLDL will be first nascent VLDL, then it becomes mature VLDL. So when it becomes mature VLDL, it will get this C1, C2 and apoE from the HDL, because it is required for the cleaving of VLDL into IDL and LDL also. So these are the apoproteins in the VLDL. So you can see here apoB100 is the major apolipoprotein in all of these. Why these apolipoproteins becomes important? These apolipoproteins are the one which will guide this, which will guide like a GPS. It will tell this lipoprotein where to go, what action has to be done. It is a brain. So apolipoproteins are very important. So the main apolipoprotein is apoB100. So this is very important for this because of the receptor of VLDL to act with the receptor interaction, etc. it will require. When the mature VLDL is there, it will have apoC1 and C2. This is given by the HDL. Because of this C1 and C2, it will activate the lipoprotein lipase, and when the lipoprotein lipase is activated, when the VLDL will reach the peripheral tissues, what they will do with this lipoprotein lipase, the triacyl glycerol is broken down into fatty acid and glycerol. So to break into fatty acid and glycerol, you will need C1 and C2. So this is given by the HDL, because only when it will break down the VLDL, it will take the free fatty acid. Glycerol will go to the liver again. So this free fatty acid, to utilize it, you will need C1 and C2 to activate your lipoprotein lipase. And apoE is again given by the HDL. Because of this apoE, VLDL can directly enter into the liver. Liver has receptors which can directly take this excess VLDL and it can utilize it. It can remove it. But suppose if there is any abnormality in this apoE or VLDL excess or any metabolism which is altered in the liver, you can lead to fatty liver because of excess of triglycerides in the liver. So these apoproteins, they play a very important role. Like I've told you, apoE for the entry, for entry into the liver through the receptors, apoC1 and C2 to cut to cleave the activation of lipoprotein lipase, and apoB100 to deliver it to the peripheral tissue, you require apoB100. So you can see here, this is the liver, and here you will see this cholesterol and this triglyceride and this apoB100. They are all packeted nicely now, and in that packet now is carried by this VLDL. So this is your VLDL. See, you can see the apoB100, which is the main apoprotein here, and this is the nascent VLDL. So once this nascent VLDL comes in contact with this HDL, HDL will give it this C1, C2 and apoE. So this mature VLDL will now have B100, C1, C2 and apoE. So this will now, it will come to the peripheral tissues. Okay, peripheral tissues like your skeletal muscles, your fat cells, etc. So once this will come to your fat cells, your skeletal muscles, etc., what happens? Because of this C2, it will activate lipoprotein lipase, which are on the capillaries of these tissues. So lipoprotein lipase will help in the breakdown of this into free fatty acid and glycerol. Glycerol goes back to the liver. So this free fatty acid is utilized for giving energy. Excess of free fatty acid is stored. Okay, this VLDL can directly be shunted here into the liver also with the help of this receptor. So now this VLDL will be broken down into VLDL remnant or the IDL. So what happens here, once it is broken down, the triglyceride level goes down. So now here you will see that this VLDL remnant will be later converted into LDL. So this C2 will go back to HDL, E will go back to your HDL, and this will be later converted into LDL. So LDL will be having more of cholesterol now. Triglyceride will reduce and it will have only apoB100. With the help of this apoB100, it will load the cells with the cholesterol, and cholesterol is utilized. So the liver has receptor for apoB, apoE receptors, etc., which can take this IDL, your VLDL, and it can utilize it. Is the main function of this VLDL? VLDL, the main function is to carry the triglyceride from the liver to the peripheral tissues, and this triglyceride is then utilized by the peripheral tissue either as a storage form of energy or to give energy instantly. So as the VLDL will circulate, it will lose the triglyceride and it will transform into IDL and LDL. So this is VLDL. The major core lipid here is endogenous triglycerols. The apoproteins are B100, C and apoE, synthesized by the liver. Where it goes, it will deliver the TGs to your extrahepatic tissues. The major lipids here are the triacylglycerol, and the major function is to deliver the endogenously produced lipids, where from the hepatocyte the liver itself produces. There is an de novo lipogenesis happening in the liver. So to carry that lipids to the peripheral tissue, extrahepatic tissue, you need a carrier, and that is your VLDL. So if the level of VLDL is more, we have certain problem. We have atherosclerosis, coronary artery disease, the brain vessels getting involved. You can have stroke or you can have peripheral artery disease. So if the level of VLDL goes more than the expected range, you are at a risk of developing all these diseases. Other important complications of increased VLDL is it is linked to diabetes. So whenever there is increased VLDL, it is linked to insulin resistance and it is a precursor for type 2 diabetes. It is also linked to metabolic syndrome. That means the patient will have high blood pressure, blood sugar is high, triglycerides are high, HDL is low, patient has a central obesity. The men will have a waist circumference which is more than 95 centimeters. Women have a waist circumference which is more than 80 centimeters. And also excess of VLDL can lead to non-alcoholic fatty liver disease. So NAFLD, excessive TGs can lead to non-alcoholic fatty liver disease. VLDL, what should be the normal range? It should be less than 30 milligram per deciliter. See, your cholesterol, your triglyceride, your HDL, all these are directly the machine will give this results. Whereas your VLDL, majority of the time even your LDL, etc., they are calculated values. VLDL is definitely a calculated value because it is difficult to measure it directly. So it is estimated from your triglyceride. So the VLDL is how it is calculated, TG in milligram per deciliter divided by 5. Okay, so this is VLDL. Total cholesterol is what? HDL plus LDL plus VLDL. VLDL is equal to triglyceride divided by 5. But if the triglyceride level is more than 400 milligram per deciliter, this formula will not hold true. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.